Welcome everyone to Quarantine Capitalism, the Saver NHS Question Time. My name is Tom Barker and I'll be chairing this live online meeting. So just so you know a bit about me, I'm the secretary of a campaign group called Saver NHS Leicestershire. I'm also a member of Socialist Alternative. My work situation is that I'm a teaching assistant, so I am actually a key worker, although I'm not currently being asked to come into work. That may change in the future. So obviously we're living in unprecedented times, with probably the majority of people here already under lockdown due to the spread of coronavirus. Across the globe, health systems which have been ravaged by decades of neoliberal capitalism are close to collapse. The Tories are failing on every front in this country in their response to the coronavirus. They've been slow to act, even when urgent lessons from other countries were being drawn by scientists. When they have acted, it has been under the weight of growing public anger, opposition, and what we're now seeing increasingly is wildcat strike action in various sectors. So things are obviously happening very quickly. And just yesterday, the Tories announced that they were going to write off £13 billion in NHS debt. This has raised the further question of what about the other £55 billion owed through the private finance initiatives. I think it's becoming increasingly clear to a broad section of society that the Tories' main priority is to protect private profit, not human lives. Along with the amazing solidarity that is being demonstrated by working class people, such as the 500,000 NHS volunteer force, this has exposed really just how cynical and callous the Tories and the capitalists who they prop up really are. And I think we see this most clearly in the crisis in our health services. Of course, the Tories did not cause the coronavirus pandemic, but the cuts and privatisations that have been carried out over the recent period, which has increasingly run services for actually minimum need, has left our NHS near to collapse even before the crisis hit. Frontline NHS staff are fighting with one arm tied behind their back, I read the other day. So just a bit about the format of the meeting. So we have three speakers who will introduce themselves in a minute. This is a question and answer session, and we've been asking for questions over the last week. So you might expect we will not be able to get answers to all of them because there were quite a few, but we've tried to include a range of the questions asked. But if you have asked a question which you don't feel gets adequately answered, please post it in the comments underneath, and I'm sure people will try to answer, or we can take up some of those issues later on after the meeting. If you check in the comment section as well, you will see that we've posted a survey there. Obviously, this crisis raises a number of political issues very sharply, and one of those is the need for ordinary people to get organised. Socialist Alternative is part of an international that is active in more than 30 countries across the world, fighting to end capitalism and replace it with a system which represents the interests of 99% of us, not the billionaires. So if you're interested in getting involved, please fill in the survey and we can keep in touch. Now, just over to our speakers, I'll let them introduce themselves, as I'm sure you'll be keen to hear from them directly. Jackie.
Hi, yes, thanks Tom. I'm Jackie Grunsell. I'm a GP in England and a Socialist Alternative member. I've been involved in socialist politics for 30 years now, but for the past decade, I've been particularly heavily involved in a lot of campaigning around the issue of health, cuts to the health service, privatisation to health services, and two mass campaigns to defend health services in the area where I work. The most recent being the Hands Off HRI campaign, which has been trying to defend our hospital from a centralisation process and cutbacks to the services, which we're still fighting for.
Thanks, Jackie. Next, Mike.
Hi, everybody. My name's Mike Forster. I'm the National Chair of Health Campaigns Together, which is an umbrella group overseeing and trying to coordinate the work of about 150 local health campaign groups. I'm also the chair of the local campaign group Hands Off HRI, the same as Jackie, So we're both fighting hard to maintain all NHS services in Huddersfield. And I'm also a member of Socialist Alternative and delighted to be with you today.
Thanks, Mike. Finally, Eljeer.
Hello, my name is Eljeer Hawkins. I'm a member of Socialist Alternative in the United States. I've been a member for the past 25 years. I'm a healthcare worker, surgical technician for the past 13 years at a hospital in Manhattan. And I'm absolutely ecstatic to be here to engage in conversation and answer some of the questions.
Thanks a lot, Eljeer. Okay, so to start off, we've got the first question from Julie in Leicester, and this is directed at Eljeer, but others might want to speak at it as well. So she asks, what is the current situation with the crisis in New York, and how do you think the US healthcare system is contributing?
It's clear here in New York, we have over 100,000 positive cases of the coronavirus. We have here in New York City alone over 57,000 cases, and throughout the state of New York, there's 2,935 dead from the coronavirus. We are in the epicenter of the virus here in the United States. The 40 years of massive budget cuts to social and public spending, particularly around healthcare, has been alarming. In fact, for the past 20 years, starting in 2000, we've lost 21 hospitals. In 2003, we've lost 15 hospitals in New York City alone. It's not just a question of the loss of beds. It is also the loss of jobs, the loss of key equipment and resources that a hospital brings with it. And now, for so long, we've been asked to do so much, but with so little. And now that this pandemic is demanding more, it is clear from the political and economic establishment that healthcare was not a priority. And in fact, healthcare in the United States is looked upon as part of the profit margin and motive. It's looked upon as a corporation, in fact. And if that corporation fails, well, then we need to shut down the hospital and then build something else on the very land that the hospital sits on. And so what this pandemic has unleashed, particularly here in New York, the actual incompetence, but also the criminality of the system to really deal with this in a really serious way. Governor Cuomo, who's getting a lot of high marks, and particularly we have a President Trump who is an idiot in chief, no doubt about that. So anyone could look very, very good compared to Donald Trump. But what has not been discussed, and this is my final point, what has not been discussed is the fact that Cuomo in his state budget has basically attempted to slash key resources. And one of the key resources is in healthcare. While he's on TV making pleas for more help and more assistance, his budget is basically a budget that will be balanced on the backs of ordinary working people and the poor in the midst of this pandemic.
Thank you, Eljeer. I mean, it's very enlightening, also very alarming as well. I'm sure others will agree. Obviously, we have the NHS in this country, but Mike, do you think that there is a warning for us in what Eljeer is saying?
Well, definitely. Unfortunately, we know that the health service in America is wholly privatized. Workers have to fall back on private health insurance in order to get any kind of medical care. And that's a direction in which this conservative government in this country would like to take us. It's also been the direction of travel towards a privatized service over the last 10 years. We can't afford to let our national health service to go in the direction of America. The private sector, as Eljeer has said, is interested in one thing, that's their profit margins. And we have a privatized sector operating inside our health service already. So we have to watch these companies very carefully. I noticed in the announcement that Hancock made yesterday that the pharmaceutical company, which they've come to an agreement with to provide testing, is an American company. These are the big pharma companies that Labour was warning about in the general election that want to get their foot into the door of our National Health Service. And that's a very dangerous foot and one that we must warn against. Our NHS, as you pointed out, Tom, is already at stretching point because of underfunding and backdoor privatisation. Might not be known by all your viewers, but 9,000 acute beds have been lost in the NHS over the last 10 years. Trusts have a £14 billion worth of debt, and the debt that Hancock has written off is not the debt that they carry. It's money that they haven't yet spent, and therefore that's still a massive overhang. But also hospitals have got £6 billion worth of urgent outstanding building work that must be completed for these buildings to be able to provide a decent service for staff and patients. We now spend less per head of population in this country than any other European country, and that should be a warning to us all. That needs to be addressed urgently. And we now have to add into the mix that there are more acute admissions taking place, and we can see that our National Health Service is unfortunately unprepared for this pandemic. We must resist any further privatisation. We've got to focus in this country on a publicly funded NHS that's got the proper public funds to maintain all the services that we need. Thanks.
Thanks, Mike. That's really useful. I think this is touching on some of the issues that will come up in some of the later questions as well. So the second question is from Dan in Coventry. This is directed at Jackie and Eljeer, really, as frontline workers. So do PPE masks work to prevent contracting illness? And if so, why have nurses not been given them? So Jackie first.
Yeah, well, they do work. It depends, basically. It depends on the situation in which they're being used and what protection is provided. So it needs to be the right mask for the right situation, depending on what kind of care that healthcare worker is involved in. But masks alone are not enough. Healthcare workers need a variety of different protective equipment, including eye protection, full sleeve gowns, and gloves, obviously. And it's not just healthcare workers that need it. It's also carers, people, anyone really who's involved in direct facing contact with people that could potentially have the infection. So, and you know, from shop workers to carers, and as for why have nurses not been given the protection, well, we're being told it's a supply problem. I would say it's a serious problem of, firstly, a lack of any preparation, any proper preparation for this situation, when we had full warning for weeks, actually, of what was coming. And there was an extremely complacent, negligent attitude of this government towards what was about to happen. And no preparative steps were put in place, no planning was made. We could have been building up stocks of PPE for several weeks prior to this hitting this country. But of course, they wouldn't do that because there was a cost involved in that, and the government were extremely complacent about what was about to happen. But also, there's a problem with the capitalist model, the fact that we're relying on private companies to provide this equipment, this just-in-time production, so that there's no stocks of this kind of equipment in warehouses, in storage. They're made as required, and so until there's demand for it, then none of this stuff has been made. And of course, the main problem is that healthcare workers themselves have not been directly involved in deciding how many are needed and how to distribute them, because that would have meant they got to the right places where they were needed in time.
Absolutely. Thank you, Jackie. Eljeer, do you want to comment on this?
Sure. I think Jackie touched on a lot of points that's so similar to the United States. In fact, our problem is that this was known since October. In fact, Trump and his administration got the intelligence of what was going to arrive on the shores of the United States, and it was an absolute level of criminality on their part to ignore it, to call it a hoax. And this flows from the fact that you have an administration that really rejects science, even on the question of the climate crisis, that reject that there is a climate crisis taking place. And so we weren't prepared. And certainly the lack of these resources have led to the death of nurses. In fact, in the United States, 20% of those who now contracting the COVID-19 virus are nurses now, who are on the front lines, who don't have the proper masks, gloves, and gowns. Every hospital, in the hospital I work in, is being rationed. In fact, you're asked to use one mask or one gown, once a week, and then maybe you get another one the following week. Mind you, this is in the richest nation in human history. In fact, Trump has basically the authority to repurpose the various manufacturing firms and warehouses to start to produce gowns and gloves and masks. He has done that in a limited sense, but we have to keep in mind, for him to go the full tilt, that means he has to then put demands upon, quote unquote, his friends, the billionaire class, to repurpose and to provide those resources. In fact, there were tons actually of material that was being produced that could have been bought much earlier before this pandemic hit the United States. And actually, the administrator said, we don't need it. In fact, a lot of the equipment, the medical equipment that comes to the United States is manufactured and produced in China. And in my hospital in November, we started to see actually some the lack of those equipment coming to the hospital. We were told that there was a national shortage, in fact. So I think my hunch is that, in fact, most of that equipment, most of that material was already infected with the virus because it was not being shipped out to the United States.
Thank you, Eljeer. It's very interesting. So the third question, which is really related in lots of ways, we did have a lot of questions about testing, including from Bridget in Huddersfield, who said building big hospitals is one thing, but surely testing should be more important. Jackie, and then Eljeer, maybe you can both come in on this again.
Well, yes, certainly if testing had been rolled out rapidly and on a massive scale right at the beginning, then testing alone may have been able to have a significant impact on the spread of the disease and the numbers of deaths as a result of it. If there had been a more rigorous approach, then the evidence from other countries that have taken that approach has shown that they've been able to restrict the spread of the virus and reduce the number of deaths as a result of that as well. But of course now we're playing catch up. So we need the big hospitals as well. We need to increase capacity for beds. We need resources across the whole of the health service, because the fact of the matter is that we're in such a state to begin with that there is no spare capacity. There is no slack in the system because of the years of attacks, of cuts, and of privatisation of services. And the NHS has been so underfunded that leaves us no room for manoeuvre, no spare inpatient beds, and no spare ventilators to use on these patients. So we need all of it at the moment, and the sooner the better. We need a lot more resources, but also critically, which is a much more, in some ways, difficult thing to get, is the staff to staff these hospitals and to care for the people that are affected. And that is a more significant problem actually for this government, because there's a huge staff shortage across the NHS as a result of the neglect over the past few years. And that is actually in many ways a bigger problem. Staff, human beings, are the most important resource in this, and we just don't have enough of them at the moment, and need all the help we can get as far as that's concerned. But yes, testing's critical as well.
Thanks, Jackie. Yeah, I mean, having the staff is one thing, but if they're not being tested rigorously, this can obviously cause big problems into the future. Eljeer, is this lack of testing a big issue in the US too?
It is. In fact, they have started up a 15-minute test, a swab that people can take, but it's very limited. You almost have to be on your dying bed for you to get tested. Even if you show symptoms, they're very reluctant to do that. Once again, it goes back to the fact that the underfunding, right? The private character of our healthcare system was not prepared for this very moment. And so we have a question of Governor Cuomo here in New York State. He's talking about in the next 6 days, we will not have ventilators, right? We will not have PPEs. We're just running out of it. And so he's asking for more and more. And certainly the federal government has made it clear, and they're doing this weird kind of states' rights approach around the resources. They say, well, the states have to kind of find their way and find that material and resources, and that the federal government has its own stockpile. Well, what we have, while this is going on, people are dying, and the more tests that you give, the more results of positives that you have. But the issue then becomes, do you have the beds? And here in New York State, we've lost 20,000 beds for patients throughout the state, right? Our numbers are going to go up. The 2,935 dead throughout the state it's basically equal to the loss of life that we had during the World Trade Center bombing of September 11th, 2001. And certainly by Monday, those numbers will exceed that. So yes, we must get tested, but we also need all the beds, the resources to take care of the patients, and also quarantine the patients who are positive so they don't affect the people within the hospital. And for the hospitals to create the space, we have had now a floating hospital that unfortunately only has 3 patients there. Right? It's supposed to take 1,000 people. There's only 3 patients there. So there's a level of bureaucracy that's also going on here as well.
Thanks, Eljeer. Yeah, I was just saying, it indicates really why it's so important to have workers directly in control of these things. So at this point in the meeting, I'd like to take a moment to ask if you are enjoying this rally, and if you've enjoyed the other videos and the content that we've been putting out in recent weeks, that you consider making a donation to Socialist Alternative. It's obviously more difficult at the moment for us to be out campaigning and fundraising on the streets in the same way that we usually are, but we still have standing costs, and I think it's never really been more urgent that a socialist message is being put across. As an organisation, we don't receive any rich backing. All of our support comes from workers, young people, unemployed people, and the oppressed, most of whom have already been financially damaged by this crisis. We understand that people have faced a decade of wage stagnation and austerity, though, so we are being really truthful when we say that small donations just are as important as bigger ones. Just to put it in concrete terms, think of some things that you may be going without this Friday evening. Maybe you might be able to donate the cost of a drink that you have when you go down the pub, maybe the cost of a cup of coffee in a cafe. Maybe you're doing without toilet paper, like a lot of people. Can you donate the cost of 9 Andrex toilet rolls? But maybe some others of you might be receiving a bit of extra overtime payments, for example, and be able to afford a bit more. So could you give £10, £50, or even £100? And we assure you that every single penny will be put to good use, building the fight back against the capitalist system in this country, but also internationally. You can donate by clicking the donate button on our homepage, Socialist Alternative, homepage socialistalternative.net, which should be posted in the comment thread below in the feed here. I'm sure somebody's doing it. So the next question, number 4. This is really, I think, directed at Jackie. So it says, we had a few questions on specific areas of healthcare suffering as a result of the crisis. We've had Paul ask about mental health, Felicity's asked about maternity services, and Caroline about social care. And we can't really go through all of these individually, but maybe Jackie could say a bit about the general strain on health and social care services at the moment.
Yeah, well, all services have suffered cuts over the past couple of decades, really, in the NHS. And as I was saying earlier, there's no spare capacity. In fact, the most many can do is barely keep up with demand. And some services can't do that, even at the moment, without the extra strain of this situation. From my perspective, then, I suppose social care services I would have to highlight as one that have particularly been neglected over the past few years, and the one which we are going to be relying on and is desperately needed, actually, and needs to be expanded hugely to meet the demands of this crisis. Because of and also to some extent mental health services as well, and I'll explain a bit about what I mean by that, because many of these services in these areas have been privatized, and they're run on a shoestring, in particular social care, with and with a loss of staff potentially due to people being unwell themselves. I think that's going to cause real crisis and hardship for those that are being cared for in this situation. And with hospitals desperate to discharge people early who have other healthcare conditions to try to be able to create capacity to deal with the coronavirus patients, then it's going to become very difficult to do that without a really properly functioning up to the challenge social care system. And the other area that's a big problem is the mental health service, because that service, the wait time, certainly again in my area, and it is uneven across the country, but in my area, people can be waiting at least 6 months for access to mental health services, if not longer. And a lot of the gap in that service has been plugged partially by the voluntary sector, mopping up some of the trying to help, doing what they can for people that work for that service. But those services under this situation have just closed, and there is no backup. There is no service to replace them, and people are obviously suffering, particularly at the moment, with increased isolation, anxiety, and depression, and those who face difficult situations in their families, having to be isolated with them, domestic violence and so on. Those services are just not out there at the moment to help those people, and that is a really scary situation, to be honest. In terms of just coming back to home care, because I think that is a service that is massively underfunded, undervalued by this government, and extremely important. If there was one key service, really at the moment, I think that is one, and the people who work in that sector really need to be properly paid, brought back. That sector needs to be brought back into public ownership desperately, and run in a properly planned way to meet the needs of society. And it needs to be done now. Really, we can't wait for that to happen. The private sector have proved themselves really incapable of providing that service properly. In terms of maternity services, then campaigners have been campaigning for years around cuts in that service that have been taking place, myself included, over the past decade. It possibly won't be quite as directly affected by this crisis in some ways. The main thing that might happen is access to some of those services, and some of the voluntary sector support services for women who are breastfeeding and things like that are probably going to disappear for the next few months. And that is probably where there are problems, but there are already cuts taking place in that service, and that is ongoing and something that we have to fight against, really. So yeah, I mean, I could go on about just about every single aspect of healthcare and how it's going to impact on people's lives over the next few weeks. General practice, of course, as well. But I won't bang my own drum too much, and I'm sure others will comment on that.
Thank you, Jackie. So next question, we're going to combine two questions. Mark asked, will the current crisis slow the pace of privatisation? And Nick from Leeds, Keeper NHS Public, asked, how would a fully funded NHS free from the internal market and competitive tendering have been better placed strategically to respond to the coronavirus crisis? So what we're asking really is about the impact and future prospects for privatisation in the NHS. So can you take Mike, then Jackie on that?
Thanks, Tom, and thanks for those questions. In this country, 18% of the National Health Service has already been outsourced to the private sector. Virgin Care is one of the biggest providers. And people will be right in asking the question, how on earth has that happened in this country when we set up what was called a National Health Service? Successive governments over the last 15 years, not just the last 10 years, have been taking us in that direction. To its shame, Labour began the process when they transformed hospitals from care providers to what they call foundation trusts. And foundation trusts were all given their own budget, they function within their own internal market, and they compete with each other. So how can you plan a national health service if you've got competition going on between, but also within hospitals, between different departments? Of course, the Tories carried on with that process, but we shouldn't forget that the private finance initiative, Tom, that you mentioned at the beginning, was also begun by a Tory government and was the flagship of both Gordon Brown and Tony Blair, and which has saddled the NHS with all kinds of debt that we now have to endure. In our area, where we have a combined trust between two areas, Calderdale and Huddersfield, they borrowed £68 million to refurbish a hospital, and the repayments are £800 million. That's 10 times more than the original loan. And that's owed to a company called Lend-Lease, which should hold its head in shame. Then we had the Health and Social Care Act, which was introduced by the Conservative Condem government. The Health and Social Care Act took central control of the NHS away from government and put it into the hands of quangos. National Health Service England and Public Health England, Public Ill Health England, I think we should call it. And now all trusts are obliged by these two quangos to put all of their services out to tender, including to the private sector. And that's how the private sector has got its hands on our services and are now running them for a profit. So taken together with the funding cuts that we've endured in the NHS over the last 10 years, as has been mentioned, but we do have to emphasise this, there are 100,000 staff vacancies in the NHS. How can they expect to cope with the pandemic with that level of vacancy? But also, in the last 3 years, 5,000 people have died on trolleys in accident and emergency departments before they could receive care because of the lengthening waiting lists. These are all as a direct result of the austerity cuts. So that's how we've got here. And these are very good questions that we have been asked. And I hope that Jackie will come in with some of the answers. But if we wanted a blueprint about how not to survive this pandemic, then the successive governments over the last 15 years have provided it. And we can't allow that to continue.
Absolutely,
Mike. Jackie, do you want to pick this up?
Yeah, I would agree with Mike's comments. In fact, the president, I think it was, of the Royal College of Emergency Medicine said exactly that. If you wanted a model of a system that is not set up to cope with the situation, this is it. And I do think, in answer to the question specifically, there may be some short-term, very short-term temporary slowing of the pace of privatisation just during the crisis, just simply because so many processes are being put on hold at the moment. So, you know, I think there may be very, very temporary respite in that sense, although the government are relying on the private sector to deliver things like PPE, testing, and the provision of things like ventilators. And we've got a member of Socialist Alternative who hopefully people will have seen before on our online presentations, who is an ITU nurse, and she's highlighted the point that, you know, we're relying on Dyson and Mercedes to produce ventilators. These are companies that have never produced ventilators before, and making a model that is possibly something that will not look anything like what the ventilators that have been used previously look like, and staff will have to retrain on how to use them. And that contract has been given to those companies because they're mates of Boris Johnson, basically, which is an absolute disgrace. Far better if we had a publicly run, democratically run provision that is responsive to the needs of the current situation. And really, what the government should be doing, what we should be demanding, is that these companies are brought into public ownership immediately to be able to meet the challenges of the situation. I do think, though, that looking forward, because of what's happening at the moment, this situation is really shining a light on the deficiencies of the private sector, the deficiencies, the fragility of a marketized NHS health service in other countries run for profits. And I think there will be a growing mood of resistance to push against any further privatisation after this. Any further moves to attack our NHS, I think, will be met by anger and big movements of people trying to stop that, including health workers who are really on the front line, and having come through this and out the other side, I think will be very reluctant to see private companies getting their sticky mitts on our services anymore.
Thanks a lot, Jackie. And I think that actually quite neatly rolls into the next question, which I think is going to be it's quite a hot topic, really. It's from Jason in Brighton. There's actually a number of questions that have got similarities, so we're going to try and take them all together. And he says, is now the right time to protest about PPE, testing, all the problems in the health service, or should we wait until the crisis is over? Paul in Coventry has asked about the role of health unions in this, and related to that, Nick asked what sort of health service do we need, and Deborah about the strategy for creating a mass movement. So this is the final question, but if I can take Eljeer first and then Mike, that would be brilliant.
I think this is the right time to raise the question of socialized medicine, particularly in the United States. During the Democratic Party presidential primaries, Bernie Sanders has raised the question with many others around Medicare for all. And it is, in fact, the right time. And the nurses, in fact, around this question of the pandemic, has been on the front lines fighting around the question of proper resources and equipment to do their job, but also to keep themselves safe as well, so they can continue to provide these services for working people, for the poor and the most oppressed, who will be greatly affected by the pandemic. I mean, here in the United States, just to take care, if you contract COVID-19, the insurance for it, if you have no insurance, if you have no insurance and are treated for it, it costs $34,000 here in the United States. If you do have insurance, if you're lucky to have insurance, it will cost you around $9,000, to have treatment for COVID-19. And if you do get the treatment and there's complications, you could get bills totaling $20,000 just on the question of COVID-19. And if you have complications. Before this, we have Obamacare, and frankly, it's a market-based healthcare alternative or system that still left 30 million people uninsured without any healthcare in the United States. And so this would provide, if we had Medicare for all in the United States, it would provide at least national coordination and also planning on how to confront the pandemic in real terms. But Medicare for all cannot be just left alone by itself. It has to, another question has to be posed, and that is the fact that we need to take all the resources, particularly with healthcare, out of the hands of the profiteers, of the private interests, the pharmaceutical companies, the insurance companies. The research should be taken out of their hands and put under public ownership, democratic control of the working class, the poor, and the most oppressed, to really decide and really put healthcare as a human right, as a priority in the society of any society that calls itself a democracy, and not have, a healthcare system that provides for all, even if you have insurance or not. So this question, this pandemic poses that question concretely. And I think what we've seen, you mentioned the wildcat strikes of recent, the nurses have been on the front lines on this, and in fact are the true heroes in this moment. But I think this will totally increase the combativity of the working class. Once this pandemic hits its high water mark and maybe settles down a bit, the working class, I think, in the United States will be on the march in a very serious way, and that the ruling elite will have to deal with this question, and it's going to be very powerful, I think, going forward.
Absolutely. Thank you, Eljeer. So if we can take Mike next on this question.
Right, sorry about that. We'll be with you, Eljeer. We'll all be marching together. Look, if it wasn't for the protests that have been going on, we would still be saddled with herd immunity strategy by this Conservative government, sending us all out onto the streets and assuming we'll get better by talking to each other. Hancock looked like a rabbit in the headlights yesterday, and he's been forced onto the back foot in order to concede that there should be more testing, which was the strategy the World Health Organization was recommending 4 weeks ago. Look, our NHS has been shouldering a crisis over the last 10 years because of the austerity cuts. The government spent £1.3 trillion bailing out the banks. The NHS budget was slashed as a direct consequence. Now only 7% of our gross domestic product is spent on the NHS compared to the European average of 12 to 13%. PFI debt in this country is actually, it's a staggering 300 billion. The figure that Tom mentioned earlier is about the value of the debt, but that's the accumulated amount that hospitals will have to pay back over the next few years. The government tells us they've done a deal with the private sector. Does anyone know how much that's costing us? £2.6 million a day. We should requisition all of the private sector resources and put them at the immediate disposal of the NHS. So we heard about 5 pillars yesterday. Socialist Alternative has got 7 pillars. 7 pillars of how we want to see the NHS restructured and brought forward. And the health sector unions have got a very important part to play in uniting with patients, service users, health professionals overall to push forward this programme and to demand a different NHS. We want proper and immediate public funding of the NHS up to at least the European average. We want an end to all the privatisation, both direct and indirect. We can't allow the private sector to be involved in our NHS any longer. All services and contracts must immediately be brought back in-house. We want to bring back all the private finance initiatives in-house. It was promised by McDonnell, but then they said they were going to do it one by one. We wouldn't give a penny of compensation to these companies that have leached off the NHS over the last period. Instead, all those PFI contracts should be immediately brought back in-house with no compensation. We want to see, as previously been said, the big drug companies nationalised. They're making profits out of our NHS. They've done the research. It cost them pennies to produce the drugs, but the NHS has to pay a fortune. They're making obscene profits from this crisis and will continue to do so. Now then, very important in this crisis is no more cuts and closures of local hospitals. NHS England has drawn up a hit list, and that hit list includes more, not fewer, closures. Every single hospital that's been threatened with closure or already closed has got to have either be reopened or have that axe lifted from them. Their plan over the past period has been to centralise all services of the NHS into big city hospitals. That would clearly fail if it was carried out over the next period. We need to have local services properly resourced, lift the closure plans. These plans have to be reversed immediately. Our campaign in Huddersfield, along with many others, have held off the closure plans over a 4-year period of fighting. But all we're doing is holding them off. They're coming back now with another plan to downgrade our local hospital. So until these closure plans and downgrading plans are taken off the table, the NHS will continue to flounder. So no more cuts and closures. We want democratic control over our National Health Service. We have to take the NHS out of the hands of the quangos, put it into the hands of the patients, of the health service unions, and of the health professionals, because they know how to plan our National Health Service, not the bloated bureaucracy that sits around these quangos up and down the countries. And that is how we would be able to seize the NHS back for the people. And finally, we want proper public funding for primary and social care. GPs at the moment are run ragged. Only 8% of the NHS budget is going into primary care at the moment. They need to have proper funding so that we can all access community care in the community and not in the hospitals. And the whole question of social care that Jackie mentioned and home care is critical. But at the moment, people cannot access that care without having to pay for it, or at least be assessed for payment. That also has got to be brought under full public control. So that not having to look at bank balances, but looking at people's needs. Those are our 7 pillars. Those are the demands that we will be put forward to ensure that the NHS is rescued from the problems that it faces. But none of this will be possible without a huge, huge fight. When this is over, we must and we will demand a huge mobilisation to bring the NHS back to the people. We helped to organise the demonstration on the 4th of March 3 years ago, where 250,000 people were put onto the streets. Well, you ain't seen nothing yet, because when this is over, we will be redoubling that call. We'll be calling for people to come out onto the streets. No turning back to where the Tories have taken our NHS. We want to see a huge mobilisation to demand those questions that we've already put forward, a properly, publicly funded National Health Service. Our lives will depend on that programme being implemented. And our time, I agree with Eljeer, is coming. And Euron Bevan, the founder of the NHS, said, we'll have an NHS as long as there are good folk out there willing to fight for it. We're the good folk who are willing to fight for it. So join us in that struggle and let's win our NHS back for the people.
Brilliant. Thanks very much, Mike. I'm sure I speak for everyone who tuned in thanking all of our speakers who've taken time out of obviously very incredibly busy schedules at the moment to join us this evening. I think it's been a brilliant meeting and we look forward to lots more. So, but before people disappear, I do want to raise a few issues. Firstly, although many of us are under lockdown at the moment, as you have heard, there is an emergency raging in our health services right now and our key services. An unprecedented health, social and economic crisis is sweeping the planet. Capitalist system is being exposed. Bosses and right-wing governments are putting profits first, with workers put in danger, sacked and impoverished, forced to work in non-essential industry, or deprived of necessary protection at work. But workers are fighting back internationally now. Strikes, protests and labour disputes have arisen in country after country. The global working class has started to show that it is the social force which is called upon to turn the situation around and ensure that lives are put before profits. Never in recent history has it been more important that people take the step of getting involved politically. So if you want to get involved with Socialist Alternative, please, like I said earlier, fill in the survey posted. Secondly, if you enjoyed this meeting and would like to see more, you can like our page, and then you get notifications of when we post stuff and videos and things like this. But you can also go to International Socialist Alternative, which is the global group that we're a part of, who are holding a live international panel this Sunday at 7 p.m. It's called Workers Fight Back, Lives Over Profit. And I think there's still going to be more speakers announced there. But so far, we've already got speakers from the US, from South Africa, from Belgium, from Russia and Ireland. So this is a truly international meeting. Again, you can follow the link in the comments or look up International Socialist Alternative on Facebook. So, okay, I think that's all. Thanks again to our speakers and the people tuning in, and thank you to the people who submitted questions. Hopefully, if you didn't have your question answered, we can have a bit of dialogue below, and we can hopefully sort of answer the question there. Don't forget to like our page and share this video so that others can see it. Thanks.